What is hyperthyroidism? Hyperthyroidism is the unusual capacity of your thyroid organ, an organ situated toward the front of your neck that discharges chemicals to manage your body's utilization of energy. All in all, if your thyroid organ is overactive and makes more thyroid chemicals than your body needs, it causes hyperthyroidism. The chemicals created by your thyroid organ are thyroxine, T4, and triiodothyronine, T3, and they assume a significant part in the manner your whole body capacities. Hence, when there is an unevenness, it can have expansive impacts on pretty much every part of your well-being. Facts about hyperthyroidism. Women are at a greater risk than men. Higher risk over the age of 60 years. Higher risk also associated with pregnancy after 6 months. At the point when your thyroid organ is overactive, your body's cycles accelerate. This speed increase can achieve hyperthyroidism indications, for example, nervousness, uneasiness, quick heartbeat, hand tremors, unnecessary sweating, weight reduction and trouble sleeping. Hyperthyroidism causes Graves' diseases. The most widely recognized reason for hyperthyroidism, Graves' illness, is an immune system issue that outcomes in your body making an excess of thyroid chemical. Overactive thyroid nodules. These develop on your thyroid organ and increases your thyroid chemical action. Thyroiditis. This is inflammation of your thyroid, and it can show up in 3 unique ways. Subacute. A difficult, amplified thyroid, conceivably from an infection or microbes. Post-pregnancy. Occurs after birth in women. Quiet. An effortless, perhaps extended thyroid, likely from an immune system condition. Expanded iodine utilization. A few food varieties and meds contain iodine, and an excess of these food can overstimulate your thyroid. Expanded thyroid chemical medication consumption. This occasionally happens to patients who are being treated with thyroid chemicals to address hypothyroidism or underactive thyroid organ. Risk factors of hyperthyroidism. Have a family background of thyroid illness. Have pernicious anemia, a vitamin B12 deficiency. Have type 1 diabetes. Have essential adrenal deficiency, otherwise called Addison's illness, a problem where your adrenal organs don't deliver enough chemicals, like cortisol. Eating iodine-rich nutrients or prescriptions containing iodine, like amiodarone. Are beyond 60 years old. Here is what to look for in hyperthyroidism in basic symptoms of hyperthyroidism. 1. Sleep deprivation. Since hyperthyroidism overstimulates the sensory system, this can make it hard for you to get a quality night's rest. As well as struggling sleeping, you may likewise encounter night sweats and wake up various occasions after you get to the bed. 2. Heart palpitations or irregular heartbeat. This is a major one. Your thyroid chemical straightforwardly influences your heart. In this way, when hyperthyroidism builds your pulse, you can encounter palpitations and strange heart rhythms, called atrial fibrillation. Obviously, anything that puts your heart in danger ought to be viewed appropriately and attended to urgently. 3. Warmth intolerance and excessive sweating. Your thyroid organ controls your internal heat level. Indeed, prepare to have your mind blown. At the point when your thyroid organ makes more thyroid chemicals than your body needs, your temperature is additionally prone to rise. Subsequently, you may get yourself unable to bear the warmth and sweating day in and day out. 4. Skin, hair, and nail problems. You may encounter diminishing hair and skin, redness in your face, elbows, and palms, plumber's nails, where the nail body isolates from the nail bed, rashes and hives, or end up startlingly going dark at a youthful age. 5. Nausea and vomiting. The connection between these side effects and hyperthyroidism has not been broadly announced at this point, yet new examination proposes that they can be significant markers of the condition. 6. Appetite changes. While higher levels of TSH are reported to lead to a decrease in food intake, T3 has been shown to do just the opposite. So, depending on which hormone your thyroid gland decides to overproduce, you could find yourself hungry all the time or feel like you're losing your interest in food altogether. 7. Emotional extremes. Anxiety, irritability, mood swings, and nervousness are some of the symptoms of emotional overactivity you might experience due to an overactive thyroid gland. 8. Fertility and menstruation issues. High thyroid hormone levels can throw your other hormone levels out of whack, disrupting your ability to conceive. Prepubescent girls with hyperthyroidism might experience delayed menstruation, while menstruating women may experience decreased menstrual flow, hypomenorrhea, as well as missed periods, amenorrhea. 9. Weight fluctuations. Hyperthyroidism is famously connected with weight reduction, and all things considered, it gets your digestion going, frequently making it troublesome, if not difficult to gain weight, even with expanded food consumption. Weight loss is also associated with increased bowel movement, sometimes presenting as diarrhea. 10. Swollen base of your neck and thyroid. Likewise called a goiter, an expanded thyroid organ is generally easy to discover and can in more extreme cases, make it hard for you to swallow or relax. 11. Expanded blood sugar. Thyroid infection has been connected to diabetes, and diabetic patients who foster hyperthyroidism have a higher danger of intricacies. Hyperthyroidism speeds up the rate that insulin is utilized and builds the creation and ingestion of glucose. This can bring about expanded insulin obstruction, which is extra risky in case you're diabetic. A number of respiratory issues can occur as well. These include shortness of breath, dyspnea, difficult or labored breathing, hyperventilation, deeper and more rapid breathing, pulmonary arterial hypertension, high blood pressure in the blood vessel that carries blood from the heart to the lungs. Early detection is important so that you and your doctor can outline a plan for hyperthyroidism treatment before it causes irreversible damage. This will prevent serious complications like osteoporosis, premature menopause, or even cardiac arrest. Diagnostic measures for hyperthyroidism include examination of clinical history, signs and symptoms, physical assessment especially on the neck, palpation to feel whether there could be any swelling, a ultrasound or atomic medication output of your thyroid to check whether it has nodules, or to decide if it is inflamed or overactive. Blood tests to check levels of thyroid chemicals, including thyroid-stimulating hormone, TSH, thyroid hormone triiodothyronine, T3, thyroid hormone thyroxine, T4, and thyroid peroxidase antibody, TPO. Hyperthyroidism treatment. Antithyroid medications. These medications interferes with the creation of thyroid chemicals. Methimazole, brand name Tapazole, is the most regularly recommended hyperthyroidism medicine, though propylthiouracil, otherwise called PTU, is preferred during the main trimester of pregnancy. Antithyroid medications convey a little danger, 0.2 to 0.5% of grave sickness patients, of agranulocytosis, which is an uncommon yet serious blood condition that can bring about death. Radioactive iodine therapy. This strategy harms the cells that make thyroid chemicals. Surgical procedure. Otherwise called a thyroidectomy, the surgical procedure to eliminate the thyroid, it is possible that one section or the whole organ can be a viable therapy for hyperthyroidism. Potential complication for surgery like hypocalcemia, low calcium in blood, and airway obstruction, however both happen in under 5% of surgical procedures. Your decision of hyperthyroidism treatment will rely upon the seriousness of your manifestations, your age, regardless of whether you're pregnant, and some other individualized well-being factors. Notwithstanding these alternatives, your physician may likewise recommend beta blockers to limit a portion of the impacts of thyroid chemicals on your body, for example, to hinder the rapid pulse and diminish hand tremors. Hyperthyroidism impacts you physically, psychologically, and emotionally. It's critical that you have a strong network of people you trust and can turn to for support. It begins with your family. Since thyroid sickness runs in families, being straightforward and open with your family members is the best arrangement, as you may be making them aware of a condition they didn't know how to pay attention to. Patients with an outrageous hyperthyroidism face an unsteady of issues, some of them hazardous. The good news, however, is numerous patients don't arrive at this degree of seriousness. Complications can include Graves' ophthalmopathy or thyroid eye disease, an eye condition causing twofold vision, light affectability, eye torment, and even vision disturbance. Unpredictable heartbeat, which can prompt blood clots, cardiovascular breakdown, stroke and other heart issues. Thyroid storm, a life-threatening condition resulting from a major stress such as trauma, heart attack, or infection. Pregnancy complications, hypertension during pregnancy, low birth weight, miscarriage, premature birth and diminishing bones and osteoporosis. Main concern. The more you have hyperthyroidism and abandon treatment, the more noteworthy the danger of long-lasting inconveniences, even after treatment. As more than 60% of individuals with thyroid sickness go undiscovered, it's essential to pay attention to your body before reversible indications like weight reduction and sleep deprivation become serious issues, like unpredictable heartbeat, arrhythmia, bone loss, osteoporosis, and infertility, early menopause. With hyperthyroidism, it's more critical to oversee what you don't eat. Undeniable degrees of iodine utilization can fuel hyperthyroidism, so it's a smart thought to watch your iodine consumption. Search for approaches to restrict iodine in your eating routine by confining your utilization of food sources, for example, fish, seafood, shrimp, dairy items, and grain items, like oat and bread. Certainly check with your physician prior to taking any prescriptions or supplements with iodine. Sodium can likewise add to edema or swelling, which is basic with Graves' disease, so you'll likewise need to watch your salt intake. While there is no specific hyperthyroidism diet, there are food sources which can give you somewhat of a lift in your battle with hyperthyroidism. Since certain side effects can sap your energy, you ought to eat lots of new leafy foods to get a consistent amount of the nutrients and minerals your body needs. Berries are a brilliant choice since they're high in cancer prevention agents, while cruciferous veggies like broccoli, cauliflower, and cabbage have intensifies considered goitrogens that can really diminish the thyroid chemical created by your body. Thanks for watching. Be sure to subscribe to stay informed about your health.